Hello, my name is Robert Smith, Chief Evangelist here at Avaamo, and we're here today to talk about the next phase of the AI revolution, specifically the AI revolution in the enterprise. Avaamo is introducing enterprise AI agents, a new class of software that enables us to create and deploy digital workers. Many of you know Avaamo, and Avaamo has traced the arc of innovation that swept the AI industry. From chatbots to virtual assistants to self-service automation, Avaamo is now deployed in 45 countries and in 29 languages across employee, customer, and patient automation. The question for us, what's next? How do we bring all these amazing advances in AI in the last few years together? OpenAI CEO Sam Altman thinks that these advances will manifest in 2025 with the first set of virtual employees entering the workforce. Avamo is fulfilling this prediction by introducing the first set of digital workers that will enter the workforce. To go into more, let's welcome Ram Menon, our CEO and co-founder. Ram, what does that mean?
Hey, thanks, Robert. I think today what we're doing is announcing a set of digital workers that could perform the role of humans. See, the stark reality today is, healthcare professionals, they spend more time looking at screens than really spending time with patients. In the customer support industry, customer support agents spend more time reading scripts than actually solving problems. And so many of us knowledge workers spend time in all these repetitive activities on Slack channels, whereas they could be doing higher level stuff. So we really think we can change that with our digital workers in a truly interesting new way. And these are not just tools, interfaces. They are fully out of the box, autonomous agents of change 24/7 that can do these tasks.
So why is that possible now and why wasn't that possible before?
Well, I think that there's a variety of things that are going on, right? LLMs have become more sophisticated. Voice models have become more sophisticated. And reasoning has come into the picture. And all these technologies have got better and better. And I've always kind of argued that these are not products. They are enabling technologies that you need to bundle, sometimes rebundle, in a way in which you can actually make it useful, right? So, new framings or a new UX to become useful. But AI has changed the concept of what a UX is. So, a digital worker really is a new piece of software that brings all these things together, coupled with Avamo's deep experience with enterprise workflows, with security, with compliance, and put it in a new framing that is off the shelf software that just works.
So what does that digital worker do exactly?
Ah, so think about, let me take a normal scenario, right? Most of us in the last few months signed up for something we do every year, benefits, right? And you typically get an email in your company email. You then kind of click on it, look at a variety of benefit insurance plans available. You try to make sense out of it. Then there's probably a 1-800 number you call trying to decipher some of this. And then you make a judgment. And you got to fill in a whole bunch of forms. And then you get a confirmation. So, I mean, this stuff is so boring and so repetitive and so painful that one of our customers was telling me 67 to 70% of the people do this in the last 24 hours. But now, with Faith, one of our agents, one of our digital workers, who's plugged into all the knowledge, who's plugged into all the backend systems, just knows. And it could be something as simple as telling Faith, hey, Faith, can you sign up or sign me up for the best insurance plan for my family this year? Faith knows who you are. Faith knows what insurance you signed up for. Faith knows what are the new insurance possibilities this year and autonomously does the job and sends you a confirmation. That's the new world we live in, Robert.
Excellent. Our first set of digital workers is actually in healthcare. Why not sales or customer support?
Yeah, that's an interesting point. I think a lot of software companies looked at sales agents, right? We had a lot of announcements around sales agents and sales SDRs, sales development agents. We kind of thought we'll do the hard problem first, right? The complexity of healthcare, the complexity of healthcare workflows, the customization that is required with many healthcare systems that have many different requirements. If you couple that with the fact that we have worked with dozens of hospital providers, in fact, I think 5 of the top 10 providers in the nation already use Avaamo. We thought we have here an opportunity to make things better. And so we focused on the patient experience first.
Some folks might say, what's the big deal? Lots of hospitals already have a virtual assistant. You can find a doctor easily and just call them.
Yeah, that's precisely the problem, right? And, you had the first phase of, like you said, chatbots, now virtual assistants. And sure, you can go find a doctor. It's simple knowledge retrieval. Then what? Then you got to call the doctor. You ostensibly will leave an email, a voicemail. They'll call you back a few days later and they'll ostensibly leave another voicemail. And by the time you're done, you're still trying to figure out and maybe took a wrong slot. And then there's the whole confirming, canceling, rescheduling. And here's the interesting business problem. Estimates say that canceled appointments, rescheduled appointments in the US healthcare system is a $350 billion problem. Because every time you cancel, that's a very expensive hour that goes waste for the doctor. So, anyway, we looked at it and we said, this is an area where we can really make a difference, provide a better patient experience. And it could be just as simple as one of our agents, like Ava, asking you what you want. And you say, hey, can you get me an appointment near my home for an orthopedician or a pediatrician? And Ava just knows and gets the job done. So that's why we kind of started looking at the patient experience first.
Anyone who's tried will tell you that integrating with healthcare systems isn't easy at all, right? Yeah, you have to keep HIPAA compliance, maintain privacy, so many different workflows for different specialties, navigating contact center IVRs.
Yeah, I know. That's I think why we are proud of what we've done here, because all that complexity is now aggregated into an elegant piece of software, right? And that just listens to you, doesn't mind if you interrupt, and still gets the job done. And perhaps it's better for me to introduce Sriram, my co founder, who's going to show you what Ava does and probably also, introduce you to Ava and have you guys have a chance to, talk to Ava. So over to you, Sriram.
Thanks, Ram. Hello, everybody. I'm Sriram Chakravarti. I'm the CTO and one of the founders here at Avaamo. I'm really excited to launch our next generation agents or agent workforce. And as Ram was saying, we have taken all the years of experience working with various different healthcare providers and model these agents very similar to what you would see when you call a healthcare contact center, whether it is a patient care coordinator, whether it's Ava, who helps you schedule appointments with your PCP, with your specialist, Danny for your MyChart management, Clara helping out with all kinds of medication refill, Aaron who can help you pay bills, and you have all these different agents who do exactly all the things that you would call in and get help with in a contact center. So let's kind of see how this experience works for a patient calling in and how Athena helps a patient with who wants to come in and schedule an appointment.
Hi, Sriram. I'm Athena, your healthcare coordinator. How can I assist you today?
Hey Athena, how are you doing?
I'm doing well. Thank you for asking. How can I assist you with your healthcare needs today, Sriram?
Hey, I have a referral to a dermatologist and I need some help trying to find a dermatologist close to my home, and I need to schedule the earliest possible time. Can you help with that?
I'll transfer you to our scheduling specialist, Ava, who can help you find a dermatologist near your home and schedule the earliest possible appointment. Hi, Sriram, your scheduling assistant. One moment while I find a dermatologist near your location and check the earliest available appointment. I found a dermatologist, Dr. Lisa Taylor, at General Medical Plaza. The earliest available appointments are on Tuesday, March 11th at 10 a.m. and 12 p.m., and Wednesday, March 12th at 2 p.m. Which time would you prefer?
Yeah, let's do the noon appointment on March 11th. I think that's what you said. Is that right?
Yes, the noon appointment on March 11th is available. Let me schedule that for you. Your appointment with Dr. Lisa Taylor.
Hey, Ava, sorry, I just saw my schedule has a conflict at the time. What was the time that was available before the noon time?
The time available before noon on March 11th was at 10 a.m.
All
Would
right,
you like
let's do 10 a.m.
Your appointment with Dr. Lisa Taylor is now scheduled for March 11th at 10 a.m. Thank you.
Great. Hey, can you also email me the location of the doctor?
Sure, I'll email you the location details of Dr. Lisa Taylor's clinic. I've emailed you the location details for your appointment with Dr. Lisa Taylor.
Hey, one more question for you, Ava. Is there any parking facility available here? Like the last time, I think I went to a different location and it took me a long time to find parking.
Yes, Medical Plaza offers parking facilities for patients. You should have an easier time finding parking there.
Great. Hey, Ava, can you also tell me how did you reason and also explain to me how you scheduled the appointment?
I am an AI agent that can reason, plan, and take action to complete tasks autonomously. When you ask me to schedule a healthcare appointment, I identify key details, check provider availability, cross-reference insurance, and book the appointment through Epic, sending you a confirmation and calendar invite. Throughout the process, I ensure compliance with privacy regulations, provide real-time updates, and seamlessly coordinate with 7 different APIs in Epic to complete the scheduling.
Wow, 7 APIs. That's impressive. Great. Hey, Ava, can you transfer me back to the patient care coordinator, please?
I'm transferring you to the patient care coordinator now. One moment, please. Hi, Sriram. I'm Athena, your healthcare coordinator.
Yeah, Athena, I talked to you before. I know. That's great. Hey, I wanted to ask you something. The last time I called, I was talking to somebody in the billing department and I got a $600 charge and I was talking to them and I got disconnected. Do you think you can, put me back in touch with somebody at the billing department?
I'll transfer you to a representative in the billing department to help with the charge inquiry. Please hold.
Okay.
While all our agents are currently busy.
Oh
Would you
man, you guys are, always your agents are always busy. Every time I call, it's always busy. Is there, just like, is there something that you can do to have them call me back?
To arrange a callback from our billing department, could you please provide a convenient time for them to contact you?
Okay, great. Yeah, sure. That's good. If you guys can call me back anytime during the week, during my lunch break is good. 12:30 p.m. You can call me. You can have them call me on my cell phone number that's on file. But make sure you tell them to look up my details, look up the charge, so that when we have the discussion, I don't have to repeat everything that I said. Okay.
Got it, Sriram. I'll arrange for a callback from the billing department at 12:30 p.m. during your lunch break. They'll reach you on your cell phone number on file and will have your details ready to ensure a smooth conversation.
Cool. Thank you so much. That was excellent.
Wow, that was a really immersive experience. And getting Ava to explain how she reasoned and performed her actions was fantastic. I can't help but ask, how did the engineering team pull off such an incredible experience, handling those interruptions and left and right turns you had in the conversation?
Yeah, you got that right, Robert. When we start off on this journey and we were building out these, digital workplace agents, the first and foremost thing that we kept in the middle of everything was the experience, right? Because we wanted these workforce agents to mimic exactly what would it be if the user had called in to a contact center agent, right? So not only were these AI agents optimized to do, reason, to plan, and to take action, but more importantly, we focus a lot on making them emotionally intelligent, being able where you could interrupt them at any point of time. You can share some long sentences, short sentences, really understood the nuance of what you were saying. So they understood that I was frustrated, that nobody was picking up the line, and it kind of understood kind of the tone of my voice, and it kind of used that in the response. And that's really the innovation that went into the product.
That's a tall order. What were the most technically challenging things your team had to do to build this immersive experience?
Well, if I had to say two things, one is what is called as multi-hop reasoning, which is if you looked at what was going on when I asked the first question about finding a doctor and scheduling an appointment all within the fastest possible time closest to my home, it had to do multiple hops, right? It had to look up who I was, authenticate me, find the dermatologists who are close to my home, find their schedules, present all this information in a nice conversational way. And that's really what is multi-hop reasoning means, sometimes with knowledge, sometimes with systems of record, and putting it all together in a simple conversational way. The second thing we really focused on is guardrails, making sure, source citation is kind of the starting point to this. Explainability is the next phase of this. Really kind of, putting it all together in an enterprise context, making it compliant, making sure that it works within the confines of the content and workflows that have been defined by the enterprise. That's really where the magic is.
Excellent. Thank you, Shriram. To wrap things up, Avamo's vision goes beyond mere automation. We're creating intelligent digital workers that don't just assist, they execute independently across healthcare, employee support, customer service. These are way beyond tools, use cases, or interfaces. They're autonomous agents that operate 24/7 across every channel of your enterprise. Thank you to Ram and to Sriram. I'm Robert, and we'll see you again soon.